This is Chapter 4's pronunciation of terms on page 155. Our term, we have abnormal. This is pertaining to being away from the norm or irregular. Adrenal glands, 2 endocrine glands, each above a kidney. The adrenal glands produce hormones such as adrenaline and hydrocortisone. Analysis, separating a substance into its component parts. Anemia, deficiency of hemoglobin and/or in the number of red blood cells, which results in reduced oxygen to body cells. Antepartum is before birth. Antibiotic, a chemical substance produced by various microorganisms or fungi that inhibits or destroys bacteria or other small organisms. Antibody, a substance that works against germs, produced by white blood cells when germs enter the bloodstream. Antigen, foreign protein such as bacteria or a virus that stimulates white blood cells to make antibodies. Antigens are then destroyed by antibodies. Aphasia, absence or impairment of communication through speech. Apnea, not able to breathe. Atrophy, decrease in size of cells within an organ. Benign, not cancerous, a tumor that does not spread and is limited in growth. Bilateral, pertaining to 2 or both sides. Bradycardia, slow heartbeat. Congenital anomaly, an irregularity present at birth. Dialysis, complete separation of waste from the blood when the kidneys fail. Diarrhea, discharge of watery waste from the colon. Dysphagia, difficulty swallowing. Dysplasia, abnormality of the development or the formation of cells. Normal cells change in size, shape, and organization. Dyspnea, painful breathing. Dysuria, painful or difficult urination. Ectopic pregnancy, development of the zygote in a place outside the uterus. The fallopian tubes are the most common ectopic site. Endocrine glands, organs that secrete hormones. Endoscopy, process of viewing the inside of hollow organs or cavities with an endoscope. Epidural hematoma, pathologic mass of blood above the dura mater, the outermost layer of membranes surrounding the brain and spinal cord. Excision, act of cutting out, removing, or resecting. Extrahepatic, pertaining to outside the liver. Hemigastrectomy, removal of half of the stomach. Hemiplegia, paralysis of one side of the body. Hyperglycemia, higher than normal levels of sugar in the blood. Hyperplasia, cells increase in number. The prostate gland is enlarged in benign prostatic hyperplasia. Hypertension is high blood pressure. Hyperthyroidism, excessive activity of the thyroid gland. Hypertrophy, enlargement or overgrowth of an organ or part of the body as a result of an increase in size of individual cells. Hypoxia, deficiency of oxygen in tissues. Hypoglycemia, blood condition of decreased sugar. Incision, cutting into the body or an organ. Intervertebral, pertaining to lying between 2 backbones. A disc is an intervertebral structure. Intrauterine, pertaining to within the uterus. Intravenous, pertaining to within a vein. Malignant, tending to become progressively worse. The term malignant describes cancerous tumors that invade and spread to distant organs. Metacarpal, bones of the hand between the wrist bones and the finger bones. Metastasis, spread of a cancerous tumor to a distant organ or location. Neonatal, pertaining to new birth, the first 4 weeks after birth. Neoplasm, any new growth of tissue, a tumor. Paralysis, loss or impairment of movement in a part of the body. Paraplegia, impairment of loss of movement in the lower part of the body, primarily the legs and in some cases bowel and bladder function. Parathyroid glands, 4 endocrine glands behind the thyroid gland. These glands are concerned with maintaining the proper levels of calcium in the blood and bones. Perianal, pertaining to surrounding the anus. Periosteum, membrane that surrounds bones. Polydipsia, excessive thirst. Polyneuropathy, disease of many nerves. Polyuria, excessive urination. Postmortem, after death. Postpartum, after birth. Precancerous, pertaining to a condition that may come before a cancer, a condition that tends to become malignant. Prolapse, falling down or drooping of a part of the body. Prolapse literally means sliding forward. Prosthesis, artificial substitute for a missing part of the body. Prosthesis literally means to place before. Quadriplegia, paralysis of all 4 extremities and usually the trunk of the body caused by injury to the spinal cord in the cervical region of the spine. Relapse, return of disease after its apparent termination. Remission, lessening or absence of signs and symptoms of a disease. Resection, removal or excision of an organ or structure. Retroperitoneal, pertaining to behind the peritoneum. Subcostal, pertaining to below the ribs. Subcutaneous, lower layer of the skin. Subdural hematoma, collection of blood under the dura mater, the outermost layer of the membranes surrounding the brain. Subscapular, pertaining to under the shoulder bone. Subtotal, less than total, often just under the total amount. Syndrome, set of symptoms and signs that occur together to indicate a disease condition. Tachycardia, condition of fast, rapid heartbeat. Tachypnea, condition of rapid breathing. Transabdominal, pertaining to across the abdomen. Transurethral, pertaining to across or through the urethra. Tricuspid valve, fold of tissue between the upper and lower chambers on the right side of the heart. It has 3 cusps or points and prevents backflow of blood into the right atrium when the heart is pumping blood. Ultrasonography, recording of internal body structures with sound waves. Unilateral, pertaining to one side. And urinalysis, examination of urine to determine its contents.